Hey guys, this is the Banjana and you are watching Eduplex. So today we'll be talking about a short topic from head and neck, that is Bell's palsy. Basically we'll be covering this whole topic in just 14 points, out of which 11 points we'll be covering in a diagrammatic form, whereas the other 3 points we'll be including in a PPT form. So let's get started with the PPT first, then we can proceed to the diagram.
So let's quickly jot down the important facts and topics of Bell's palsy. Before going to the main topic, the primary fact to be understood is it is an acute onset of non-suppurative inflammation of facial nerve above the stylomastoid foramen, producing unilateral lower motor neuron facial palsy. Now, done with the definition, we are getting into the details of the topic. There are three introductory points. Those are infranuclear lesion of facial nerve at stylomastoid foramen. So basically, the facial nerve consists of the extracranial course which appears from the stylomastoid foramen. That is, the lesions involves the motor nucleus of the facial nerve. Now, the upper and lower quarter on the same side of the face gets paralyzed. That is, it is an ipsilateral paralysis. So, talking about this, if we take this face to be the face of the affected person, we are dividing it into 4 quarters. One with the horizontal line dividing it into upper and lower quarter, and one with the vertical line dividing it into right and left. So, the left cerebral hemisphere governs the right side of the face, whereas the right cerebral hemisphere governs the left. Now, let us get into the third point. That is, because of the paralysis of the motor supply of the facial nerve, the affected side gets paralyzed. So, the causes or etiology of the disease. Basically, it is an idiopathic facial paralysis, that is, the cause is unknown. However, we can think viral agent to be a cause or the reactivation of herpes simplex virus to be a cause. Again, trauma and infection can be suspected as one cause also. Since the paralysis is an idiopathic one, no particular diagnosis can be done. However, physiotherapy can be one of the options, or in severe cases, corticosteroids can act on nerve inflammation. So, as we are done with the topic, we can now get into the 10 points from the diagram.
So I have already drawn the diagram of the face and divided it into 4 quarters, the upper half and the lower half, and right and left half of the face. So let us start with the 11 points we need to know from the diagram. The first point is loss of wrinkles of forehead. So the affected side of the face does not have any wrinkles, whereas the side which is not affected have folds and wrinkles on the forehead. So this is the first point, loss of wrinkles of forehead. The second point is, as we can see, inability due to the impairment of motor supply, there is an inability of close eyes. With that, we have the overflow of tears, that is epiphora. The fourth point is sagging of lips. Now, with the sagging of lips, we also have one more, that is, the next feature is of saliva and submandibular impairment. So the submandibular, sublingual and lingual impairment of glands affects as the drooping of saliva. There will be no nasolabial fold. The nasolabial fold is absent in the affected side. The next point is that the face is pulled to the healthy side. So as this side is affected, I have colored it with blue. This side is the affected side and this side is the normal side. The affected side is pulled downwards, whereas the face is pulled towards the healthy side. The next one is in the vestibule. Vestibule is the gap between the lips and the teeth. That part is known as the vestibule. Next point is air leak from between the lips, which we cannot draw in the diagram. So those are, there is an hypersensitivity to loud noises. The patient is hypersensitive to loud noises. And the last point is 2/3 of the tongue becomes senseless, that is no without taste sensation. These are the 11 points. With this we finally end this topic. And if you cannot remember and want to have the mnemonics, you can also go to my Instagram profile. I have updated the mnemonics over there. So thanks for watching. If you like this video, please give it a thumbs up. Yet haven't subscribed? Consider subscribing and press the bell icon to get the recent updates of my videos. If you want notes of the topic, follow my Instagram profile. The link is given below.